Welcome back. In this video, I'll talk about sinus bradycardia, and I'll teach you everything that you need to know, from reading the ECG to knowing the symptoms and treating the patients. Sinus bradycardia is defined as having heart rate less than 60 beats per minute, which is about 1 beat per second. In the ECG, you will see that all the QRS complexes and other waves are essentially identical. So they all look the same, except that they are further apart. And this essentially indicates slower heart rate. For most patients, sinus bradycardia is more dangerous than sinus tachycardia, because sinus tachycardia can be caused by a variety of different causes, but sinus bradycardia have very limited amount of causes. And these include sick sinus syndrome, some medications like digitalis or digoxin, beta blockers of course, and calcium channel blockers. The latter two, the beta blockers and calcium channel blockers, are essentially used to cause bradycardia in some patients. If a patient has high heart rate, we use these medications to cause the heart rate to go down. Sick sinus syndrome is defined as inability of the heart to contract as rapidly as the body needs. In a normal patient, if somebody is running, the heart has to be contracting faster to accommodate the need of oxygen. And if they're resting or sleeping or eating, the heart rate slows down, because you don't need as much oxygen. In sick sinus syndrome, the heart doesn't meet the requirement that is needed. So you will have inappropriate heart rate for the patient's current situation. In any case, in sinus bradycardia, expect the patient to be fatigued and to have weakness, dizziness, fainting or near fainting episodes, which are all consistent of inefficient heart. If the heart is contracting less than is needed, you will have less oxygen and you will have these symptoms, which makes sense. And the less blood going to the brain will cause confusion. Feeling of palpitation might be caused by electrical disturbances. Less blood going to the hands and feet will cause cold feet and hands. The patient will have exercise intolerance, as they cannot meet the demanded oxygen requirement. The main treatment is treating the cause. If you know an exact cause that causes this patient's symptom, you should eliminate that specific cause. In any case, you can use atropine, which quickly elevates the heart rate. It's a lifesaver and is one of the few medications that increase the heart rate, and it is approved and currently used. So you should definitely know that atropine is used in cases of sinus bradycardia. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.